Okay, let's get started. Welcome everyone to the November 23rd. It's November 23rd already, 2020 meeting. Hang on one second. Okay, Curtis, I hear it. So why don't we begin? We got one new face anyways around the table. Why don't we begin with just a brief travel around the virtual table here. Neil, why don't we start with you and we'll move into the board members after we're done. Oh, you're muted, I think, somehow, Neil. Why don't we start with Mike Langeway?
Good morning. We met Councillor Turner before. Welcome. Mike Langeway,
his name's Mr. Turner here, Mike, but we're a fiduciary board, but I appreciate the sentiment anyways. Keep going, Mike. You're off to a great start on Monday.
Deputy Chief of Professional Standards. One of the things that I will often be speaking about at authority boards is community paramedicine, which is an area that I oversee. So that's what I'll be speaking about today, and mostly my presence here is about that. So.
All right, Neil, go for it. You ready this time, you think? No, you're not ready yet. We got technical difficulties. We'll figure that one out. Adam, you ready?
Yep. So my name's Adam Bennett. I'm the operations commander. Quite often I speak to operational issues as well as the some data and analytics.
Perfect, thanks. Oh, in particular, what, Adam?
Oh, I was going to say with call demand. We can continue on.
Yeah, all right. Mike, how are you doing this morning? You got your hair cut nicely? Same as mine.
That's because I have no hair, Bill.
Yeah, I know. I'm right there. I don't know if you've noticed, but Zoom seems to, like, you know how they say when you're on TV, it adds a few pounds. I think Zoom takes a few hairs off my head whenever I'm on there. I don't know if you noticed that, Mike.
I suffer from the same problem. I think that's just, yeah.
Kate, tell us what you do.
So Mike Mirko, Deputy Chief Operations and Logistics, speaking on operations, logistics, most of the things that Adam doesn't or that Mike doesn't.
All right. Colin, you look ready to go. Go for it.
Yep. So I'm Colin Heisey. Coordinator of Employee and Support Services. I have a variety of responsibilities. So I would speak on things related to administration, human resources, and finance.
Beautiful. Cindy Howard, how are you doing?
Cindy.
Yep, I'm here.
There
Sorry about that. Oh. And if my picture goes out, it means my internet's acting up. So, good morning. I'm Cindy Howard, and I'm the General Manager of Finance and Community Services. So today I'm in the role of Treasurer for the County of Middlesex.
Wayne, what role are you playing today?
Well, I'm the county's barrister and solicitor, and Mr. Turner, just so you're aware, our office provides legal services to the authority when it's required.
Nice. And I think we might actually have Neil looking very official with his clock there. Neil, can you unmute yourself? And we'll wait for that to happen. In the meantime, let's go around the table, and why don't we start with you, Kathy? Oh, Kathy Bunting, I forgot about you. Wait a second. Kathy Bunting, I forgot about you. You're in the office and everything today.
I am in the office.
Yeah.
Kathy Bunting, I'm the secretary for the authority board, and I'm also the county clerk.
Very good, thank you. Now, CBJ, go for it.
Good morning, everyone. It's great to see everybody. And I'm Kathy Burkhart, and I'm from Lucan Biddulph.
Curtis, can you pipe in here?
I can. Curtis Smith, I'm from Adelaide Metcalfe, but I'm currently situated in Elgin County, so I have to be quiet a little bit right now. But I will talk when I can.
All right. It's always good to be quiet in Elgin County. Brian, give us what you got.
Yeah, Brian Ropp. I'm from North Middlesex. Beautiful downtown Elsa Craig.
Yeah. Is it beautiful today? It's
beautiful. It's white. It's Christmassy. Hey, take the weather as you get it.
Yeah, agreed. Well, Neil's still having a little trouble there. So Stephen, do you want to take a shot at introducing yourself now?
Sure. I'm Steve Turner. I'm from London.
Thank
Pleasure
you
to
very
be aboard.
much.
Thanks for having me.
Yep. Thanks for joining us. And I'm Bill Rayburn. I'm the chair of the board, and I'm also from London, and a very snowy London. I was out already this morning, and I think our ambulances are going to have some slip and slide issues, or maybe they did yesterday, but we'll get into that over the course of the day. Neil, you think you're unmuted yet? Or this might be a really short meeting if Neil can't unmute himself for the... No, we'll get to him, I guess. So let's see if we have, did anybody buy any ambulances and you have a disclosure of pecuniary interest of some sort?
Sorry, Bill, Neil's just saying, can you unmute him? I guess as the host, you can do that.
I can ask him to unmute. That's the best I can do. Oh, there, I think we're in good shape now. Yeah, I got you, Neil.
Okay,
Why don't you
perfect.
introduce yourself before we see if anybody bought ambulances?
Good morning, everyone. Neil Roberts, Chief, Middlesex London Paramedic Service.
Beautiful. Happy Monday to you, Neil. Okay, now item A1 on our agenda is provision for disclosure of pecuniary interest. Does anybody have any? Stephen?
Mr. Chair, I just identify, I don't believe it's a pecuniary interest. Later in Deputy Chief Longeau's report, identifies collaboration between MLPS and Middlesex London Health Unit. I'm an employee of the Middlesex London Health Unit. But,
yeah, I would agree. It's not so, but I appreciate you pointing it out to us. And so I appreciate that. The minutes from the last meeting, everybody received a copy of those from someone that was at the meeting. Can we get a mover and seconder? And if there's any questions or comments? CBJ and Brian Ropp are moving and seconded. Are there any questions or comments about the minutes as they were presented? Stephen?
Thank you, Mr. Chair. Just with respect to Commander Bennett's report, the minutes references that the report was attached. It's not attached in the copy that I was able to access online. I was wondering if perhaps the clerk might be able to forward them to me so that I can have them on hand to discuss during the budget.
Sure. Which report? So Adam, this is the report on, what was it on, call volume increases?
That's correct.
Yeah, okay, yeah, we'll get that out. I'm trying to think of how big that one was with all the graphs and everything, but we'll figure out a way to get that to you for sure.
Great, thank you.
We'll probably try to do it over the course of the meeting if we can, right, Kathy? Okay, so moved by CBJ, seconded by Brian Ropp. All those in favor that the minutes be accepted, approved? Okay, we're approved. Opposed? There aren't any. Okay, the Wayne, you might want to pipe in here, but the authority terms of reference, we need a mover and a seconder for these. This is a, well, Wayne, I'll let you describe. It's a first meeting type of thing that we need. Is that what you're going to tell me?
That's right. Essentially, this is, as you know, Mr. Chair, the terms of reference really set out how the authority has been operating for years, but it's just here to be approved at the first meeting. If there's any questions on the details, happy to answer those along with the secretary, but I'll leave that to the board.
Okay, questions or comments about the authority terms of reference? Stephen, go ahead.
Thanks. I have a number of them. Have there been any changes would be the first one, or is this just a reintroduction of kind of a standing terms of reference? One of the ones that jumps out at me at the beginning is it doesn't define who is eligible for membership specifically. From what pool is drawn to make the members. I believe it's members of county council and with the recent amendment, a member from London City Council as well as the CAO. It could be anybody, is that correct? And how do those postings then be made?
Yeah, Wayne, you want to take a shot at that?
Yeah, through you, Mr. Chair. The way the authority has always operated has been that appointments are at the discretion of council. So how nominations I can't actually speak to how nominations have occurred. I'd seek to maybe get that information from from members of the board who have been here for a while. But in terms of actually appointing, they'd be appointed at a bylaw appointed by the county council. So the process before it gets there, though, I'd have somebody else speak to that if they may.
Yeah, so I think you're correct. I mean, I think the nominations have been on the floor of county council up until recently, and we'll probably have to figure out, we don't have any vacancies at the moment, but whenever we do need to, we'll worry about that. So there's not a set number of folks from county council or from administration or from the City of London. Just the only requirement at the moment is that they are from the Middlesex London area, live in the Middlesex London area. So as we get closer to needing a nomination, that'll be something we'll discuss at the board and make a recommendation to council on. Did you have another question, Stephen?
Yeah, that's helpful. The other one was just kind of how the relation of this versus the Municipal Act and the Municipal Conflict of Interest Act kind of interplay. In this one, the terms of reference seems to have a higher standard, especially on the conflict of interest component than the terms of, than the code of conduct. And then further in it, it references and anchors where there's conflict. The Municipal Act is kind of the one that shall prevail. So I think specifically what I'm wondering is real or perceived financial or non-financial conflicts of interest and how those are navigated by members of this board. More specifically on those non-financial issues, because that becomes the standard above the MCIA.
Wayne, you want to take a shot at that one too?
Yeah, through you, Mr. Chair. The Municipal Conflicts of Interest Act, of course, only deals with pecuniary interests, but with this particular board, this is a board that's created under the Municipal Act. It's a Municipal Services Board, and it's of course an advisory board, and the authority provides the ambulance services to the discretion of council. And so council is the approved delivery agent. And so there is I guess a higher standard there in that loyalty is owed to the delivery agent. And so really that's the only, that's where the standard is slightly higher than just a simple pecuniary interest. So that's really, it's really a good faith point to honor the purposes of the board is the best way to describe that.
Yeah, and I think the other best way to describe it is it's consistent with language of other fiduciary boards in the region and throughout Ontario as well. But I think Wayne's explained it pretty well. Anything else, Stephen?
I think that the last part was just kind of the exclusivity clause. Kind of sounds like a kind of an anti-lobbying clause post-departure from the board or things like that. And I wasn't quite sure what that was meant to exclude. Sometimes when you see anti-lobbying clauses, they have a sunset date, especially at the provincial and federal levels of about 3 years or so. I'm just trying to find the reference number, but I think Wayne might be able to find that.
Yeah, he probably knows it. Go ahead, Wayne. Do you want to comment just on that one?
Yeah, I guess the comment would be there's nothing in the code of conduct that's intended to prevent free political speech when a board member is not a board member. However, to the extent that items that the board might speak about are confidential, or when board members are dealing with the best interests of the board, of the service, the authority, really that's what's expected to be honored there.
So, but the confidentiality clause beyond board member time, is that something? I agree, there usually is some sort of sunset clause on that. Is that something that we should look at? I'll give you a second to find it.
It can be. Do you know what specific section the concern is?
Maybe we can get it. I'm not sure that it's consequential to this moment, because we probably don't have anybody leaving the board in the next 2 hours, hopefully.
And I think that's fair. I flag it, if I might, through you, Mr. Chair, is just for consideration, like let's say after I'm done my time on council and I've served on this board, does this preclude me from working in ambulance services again, for example? And
Oh,
that's
I
kind of the way
see.
I read
I
it.
see. Yeah. No, okay.
Yeah.
No, it was specifically designed not to do that. So we'll maybe come back and take a look at that, and at the next, maybe even at the next meeting, considering that's this week, but we'll take a look at that. Okay, Wayne?
Through you, Mr. Chair. Yeah, I mean, no issue with a sunset clause from a legal perspective, and that can certainly be looked at for Wednesday.
Yeah.
I appreciate that. Thank you.
Okay, so with that, can I get a mover and a seconder for the terms of reference? CBJ, seconded by, oh,
Actually,
sorry,
question
Kathy,
on that.
we got to use different hand signals
Okay.
for moving and for questions, I guess, but I'm sorry, Kathy, go ahead.
Well, no, I was just going to bring up that maybe do we want to pass this then at the next meeting if there's going to be the sunset clause, or do we want to bring it back?
No, we want to pass it now, and if we have to amend it, we will.
Well, okay, all right, that's fine then. Then I'll move that.
Thank you very much. Seconded by Mr. Smith. All those in favor? Opposed, if any? Okay, it's carried, and we're moving on to the code of conduct. Questions about the code of conduct? I'll let everybody sort of check their notes. Stephen, did you have something? Yes, go ahead.
Yeah, if I might, actually, my mistake. I think I conflated the code of conduct on the terms. The clause that I was referring to here was actually number 9.
Right. Okay. That's why we
still-
both couldn't find it. That's
Yeah.
okay. That's good. Yeah, we know where it is now. Was there anything else in the code of conduct, Stephen, that you wanted to mention or that you can think of right now?
No, that's fine. I think number 8 was the other one, election campaigns. Most councillors would probably refer to their board memberships at some point in their resume when they were campaigning. They said, during my term of council, I did this, 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 and this. The number 8, election campaign, seems to preclude that.
Wayne, comments on that?
Sure, Mr. Chair. The intention of number 8 is really just I guess the duty to the board is supposed to be to assist the board and help deliver services in accordance with the Ambulance Act. It's really not, the purpose is not for political gain, and so that's really that's the main point of Section 8, and it's not to preclude someone from putting it, say, on their resume, but it's to prevent somebody from really lobbying the fact that they're on the board for a purpose other than being true to the purposes of the board.
Okay, well, maybe we can take a look at that one as well, just and see if there's more precise language that makes that clear, if it wasn't clear.
Yeah,
we'll just think that through.
Yeah, through you, Mr. Chair, there could be. That could be that could be defined in more particularity, just to just so that it doesn't prevent folks from using it on their resumes, etc.
Yeah, very good. Well, we're a little ways away from the election campaign, so we'll have some time to fix that one too, if need be. Okay, can I get a mover and seconder for item number 2, the code of conduct? Moved by Brian, seconded by, don't all move at once. Curtis is moving. There it is, the big hand from Elgin. All those in favor? Opposed? It's carried. Okay, so I'm moving on then to what Michael describes as the most exciting part of the morning, which is community paramedicine update. Mr. Langevin.
Thank you, and through Chair to the rest of the board. This is actually a quite exciting report, and I'm happy to provide some good news to the board who've heard my reports over the years. Community paramedicine has undergone a lot of changes, and I wanted to take an opportunity to provide sort of a brief history for Mr. Turner as well, but also then provide sort of where we're heading in the next little bit. As the board will remember, community paramedicine began in 2015 in Middlesex London Paramedic Service with an initial provincial funding grant. That shifted in 2017 to a base funding grant, which was provided by the Southwest LHIN, which was really the basis for most of our community paramedicine functions over the last 3 years, primarily focusing on remote patient monitoring. So that was a digital service we provided in patients' homes throughout the community, with paramedics monitoring those digital services and then responding to homes as needed as a way to prevent hospital admission. At the request of the Southwest LHIN earlier pre-COVID, I'll say in 2020, that program, we were asked to sort of ramp down that program and offboard those patients. And our program began shifting away from remote patient monitoring and more towards primary care, patient home visits. And so we rostered a number of patients through a couple of family health teams in the city and began doing home visits for those patients as we were decreasing the number of remote patient monitored patients we were monitoring. As COVID began earlier in the year, we had to shift our business model. And as the board will remember, we actually, as a result of that, did transition back to remote patient monitoring. And the rationale for that at the time through the approval of the LHIN was going to visit these vulnerable patients in their homes seemed like a bad idea in terms of being a vector for transmission. And so remote patient monitoring was started back up again for those patients that we were seeing in their homes. The other piece that we switched to at the request of the Ontario Health West Triad table was we began working with the palliative care team locally, so palliative care teams 2 and 3. Our paramedics were trained in paramedicine, community paramedicine, palliative care, and have been assisting the palliative care program locally with patients in crisis, as well as rostered palliative care patients in terms of COVID assessments, swabbings, those types of those functions in order to help navigate palliative care patients directly to hospice, get them their tests and assessments that they would need to do that, as well as to respond to the community in a timely fashion for things like pain management or other symptom management to prevent hospital admission of palliative care patients as the hospital was trying to prepare for the wave of COVID patients. Thirdly, during the first wave, we partnered with the Thames Valley Family Health Team and the Middlesex London Health Unit and worked with the COVID Assessment Center, specifically at the Oak Ridge site. Throughout the beginning of the assessment center, we've been ramping up full-time employee resources at the request of the Thames Valley Health Team to meet the demand at the site. At present, we've got 8 full-time paramedics that work Monday to Friday there doing assessments and swabbing under the medical delegation of Dr. Summers from the Middlesex Health Unit. Board will also recall that throughout the first wave, using the ESU bus, which was purchased earlier in the year, we've been providing COVID assessments and testing throughout the county of Middlesex. We were able to do a number of dates out in the county, up to 10. At present, we have nothing booked further for the county, and that we're working with the Thames Valley Health Team and Ontario Health West to meet the demand if there is any for testing in the county. At the time of drafting this report, Middlesex London Paramedic Service had completed over 17,000 COVID tests, and those have been processed through both the Ontario Public Health Lab as well as through the labs of London Health Sciences. As we finished through wave 1 and now coming into wave 2, we've had an opportunity to sort of look at our programming and determine what our next steps are going to be. So now moving into wave 2, we have begun working with the health unit again to deliver flu shots, which was a program we began last year, and we're continuing again this year, as well as continuing our work with these Oak Ridge assessment site for assessment and swabbing. As mentioned, we do not presently have any assessment sites booked or dates booked in the county, although we are positioned to do so if the demand requests it. And the final piece to our wave 2 is that we've been beginning discussion with the Southwest LHIN again, just to help with a number of ALC patients or patients who require a little bit more care or waiting placement in long-term care facilities. They've identified 79 patients that they would like our assistance with, and we are working with them right now just in terms of how we will operationalize that demand or that request. With that does come some funding from the Southwest LHIN to provide that, albeit the funding is not is not 24/7 funding, but is some funding that we're still negotiating with them just in terms of how we will meet the demand for what they're asking. The good news that has come that I did mention at the top was that we've had 2 opportunities to submit for reimbursement for some of these expenses that we've incurred. The first, both of which are through Ontario Health West, but the first is to submit for expenses incurred through the Oak Ridge assessment site. So that was a first piece that we submitted through London Health Sciences. As the board may or may not know, Ontario Health West moves the funding for assessment sites through London Health Sciences, who disperses the funds. So we've submitted to London Health Sciences for our COVID related costs. And secondly, we've submitted our expenses up to report the funding reporting time, which was the end of September, through Ontario Health West to meet the financial costs for our palliative care programming, and remote patient monitoring program, which was a 24/7 operation and remains so. So the total funding request that we have submitted is just over $540,000. And we're hoping to hear positive news about that in the coming weeks. The other piece of good news is that recently Middlesex, community partners working with Middlesex London Paramedic Service have received funding through the Southwest LHIN. So I'll kind of start to talk about a couple of those programs now that we do know about for sure, which is some may have heard about the London Police Services Coast program. So this is a program that is designed to respond to patients with mental health crisis within the City of London. And so as part of that partnership, there's funding for 1 paramedic to be assigned to the Coast team. So the Coast team will be made up of mental health nurses, police officers, and a paramedic. So as part of this 1-year pilot, we've received funding for 1 FTE for the year starting 2021, and training for that will begin in January. And we're currently in our recruitment process for selection of that paramedic. The other funding program, which I'm particularly excited about as well, is funding for London Inner Community Health. So this is a organization in the City of London that's able to provide primary care and other services to patients with no fixed address or otherwise vulnerable patients in the community who have some access challenges to primary care or patients who don't have health cards. So we, through that partnership, we've been asked to provide 2 community paramedics Monday to Friday to help their physicians and nurses provide various types of primary care to those vulnerable community members. That funding was approved by the Southwest LHIN as mentioned, and that training is to begin in January as well. And the final program that we received funding for is a one-time funding through the Southwest LHIN, and that's in partnership with Cheshire, which is a community long-term care facility, retirement home community organization. And the funding for that, the partnership with them is to provide community paramedicine support for their patients in crisis in the community who are living at home as part of their wraparound care. So that funding is until March 31st. So that funding will allow us to continue our 24/7 programming that we've been doing, and will allow us to maintain our palliative care programming that we have been doing and will continue to do until March 31st. But that does provide a little bit of financial security to our program, and we're quite happy about that. Having said all that, I appreciate that is a lot of information in a short amount of time, and I'd be happy to take any questions specifically about those programs from anybody on the board as we navigate these partnerships.
Okay, let's get the discussion started. CBJ, please.
Thank you, through the chair. Mike, great report. And this is more a comment. There's no questions. I think everybody knows what a huge proponent I am of the community paramedicine program. And I really think that your team and the work that Dustin does has to be highlighted and commended over the last few months. The way that everybody has pivoted to ensure that those that you are servicing and looking after are there's still a connection. It's just, it really does amaze me how you've been able to continue with that. And then of course, the work with the COVID testing and just how quickly that all came together, and working with our partner municipalities in the county. That was just, it was so well received through residents. You know, personally, I can tell you, and which I've shared, number of positive comments, how great it was to be able to have that testing in our communities at that time when everything seemed to be so overburdened for the need for testing. And you know, I mean, I think now the assessment centers they've got a good little routine going, and it from all accounts it's running pretty slick. But you know, should the demand increase, I know that you'll be able to pivot quite quickly. And then of course, with the flu shot and working with the vulnerable community. So as I say, it's just a comment, but I just continue to be so impressed and be able to, when I have the opportunity to talk about this program, I'm just so able, I'm so proud that I can be able to pass that along and represent, you know, represent that program in a very small way.
Thank you.
Brian.
Yeah, thank you. Through the chair to Mike. I just had a question on the last item you brought through on the private care. You said you had some funding from that long-term care facility. So is that like a partnership funding with the LHIN and with the private home as well? Or how does that funding work like that?
Sure, and through you, Chair. So the way that works is as the Southwest LHIN is coming towards the end of their fiscal, they had a number of COVID related funding that they were able to provide to community partners. And so Cheshire, through their community support services funding at the LHIN, was able to apply for a one-time grant through the LHIN to provide care to vulnerable patients in the community that they oversee as part of their community nursing throughout the region. And one of the areas how we come into play is they needed clinicians who were able to respond in a timely manner out to their patients that they're serving. And so they worked with us to be able to have community paramedicine be that clinician that can respond. So these are patients who are rostered through Cheshire's community support services program, and they simply would call us to go and respond as opposed to have any other clinician group go do that. So that's the partnership. So the funding actually goes from the LHIN to Cheshire and then to us.
Thank you.
Next questions. Curtis.
I was just wondering, with the testing that was done on the mobile sites in the county, what was the percentage of county residents that took advantage of that?
You mean versus city residents, or do you mean?
Yes, I just didn't know if we had city residents that came out to the county and utilized those mobile sites. Did we track those numbers, or? Yeah,
is it anecdotal, Mike, or do you actually know?
So to answer the question, we did not track the demographics at all of our candidates, of our patients. All we did was do our administrative team did the administrative side of it in terms of taking their health card and their address and all that type of information. But that was never kept or quantified in any way. And all we did was what we would do is we would take all our data, and we were sort of treated a little bit as a spoke, if you will, of the assessment site at Oak Ridge. So our data would just get dumped into the larger data set that comes from the city, from the Oak Ridge site.
I think a spoke from the Oak Ridge site is a great way to describe it, because from an analytics perspective, that's the way we were treated, and that's okay, but that's the way it was. Mike, I just had a question about, in this virtual world, there's all kinds of new opportunities for people to get together. And I was thinking, at some point in time, we may, I guess I better back up. I've received, and I think you've been the one getting the calls, but I received so many requests for information about our community paramedicine program from my colleagues across Southwestern and Eastern Ontario, about how the program's going, how we've managed to have such great penetration, both urban and rural. I wondered whether or not it would be wise for us, considering just how important this is to the mental health community in London, the social services group across Middlesex, London, and then of course the rural urban entity, and even special events, that we maybe hold some sort of event where we talk about the successes of community paramedicine and invite colleagues from across Ontario to participate. It would be fairly easy for us to do in a webinar format where we set up sort of 2 hours of here's what our experience is, have a few speakers, that type of thing. Because man, I'm telling you, Mike, we're getting inundated with people saying, how is this? Because especially since COVID hit, I think I've literally received 25, maybe the wardens even received more, but that's not a figurative number, like at least 25 requests for more information about how community paramedicine started, how we rolled it out, how we made it, how we got deep into the communities, including into the mental health community. And then it also fits into the City of London's plans related to, I forget what that's called. Maybe Stephen, you can help me out, but the downtown, somebody's gonna be able to help me out.
Or
Go ahead.
area action plan.
That's what I'm trying to say. And so the urban rural mix of this, I think, would be of interest to a lot of people if we could get something like that organized in the next 2 months. It's fairly easy to do technologically. So can you take that away and think about it and see whether that's something? CBJ, I see you nodding your head a lot. Is that something you're of interest in too?
Oh, yeah, absolutely. I think if you go back to the event that we held in the spring, where we had you know, a lot of provincial representatives speak to, you know, elected officials across the area. I think that you know, we've proven that we can host an event like that. And as you know, Bill said, the amount of requests and questions that I've received about community paramedicine, you know, I don't think I've received 25, but I would think I've received about 15, between 15 and 20. So I think, as I say, we've shown that we can run an event like that, and I think it would be great information to get it out across the province.
Maybe you and the chief can come put your brains together and think about that, Mike, and see what you can think of in terms of speakers and what we would say, and and then maybe we can present it back to the board at a future date with sort of like a draft of an agenda, and I can help you guys figure that out, because you need something else to do. So he says sarcastically. Okay, anything else on the community paramedicine update from Michael? Stephen?
Thank you, Mr. Chair, and through you, thank you, Deputy Chief, for your summary. It's very helpful. Can I lead off just by congratulating Dustin on his nomination for the Community Leader Award for the Pillar Awards last week. It was a proud moment for MLPS, and certainly not just to Dustin, but to the entire team working with him. I think that was well reflected in there, and to put that program on such a large stage, I think really helped to highlight the importance of it throughout the community. So well done. My question is, I guess, a couple of them. One is just with respect to, on the first page at the bottom of your report, you've got a paragraph that said funding following the reporting transition from the LIN to the Ontario Health has been uncertain. However, we've been recently given submission opportunities for one-time funding. I guess my concern is around the one-time funding versus ongoing funding. And has there been any indication from OH on what that pathway towards sustainable funding might look like?
Go ahead, Mike.
Thank you, and through you, Chair. So the short answer is no. Unfortunately, we received when the transition occurred from the Southwest LIN to Ontario Health West, we were notified that our base funding that's referred to earlier on in the report of the 174 base funding, it's our understanding that isn't continuing. Ourselves, along with other paramedic services across Southwest Ontario, are working with OH West to try to determine what base funding opportunities there are for community paramedicine. But at this time, it's all sort of been one-time grant funding that we're receiving. The London Community Health grant funding, from a positive perspective, the London Community Health grant, that grant is quite large and will go for a number of years in terms of that. The CSS one through Cheshire is only until March 31st. The piece that I spoke about at the beginning in terms of the looking after those 79 ALC patients in the community, that's one-time grant funding till March 31st. The COAST program is a one-year pilot. So we sort of live day to day with these programs, and that's the real challenge. So one of the real sources of sort of stress and hard work that we're putting in is trying to figure out how do we create base funding, and it's a real challenge. Our models in paramedicine, as you know, are quite different than some of the models of the community agencies in terms of, we don't do fee for service, those types of things. And so it's hard to sort of conceptualize what does community paramedicine cost. And community paramedicine can cost, it can be a different number for Middlesex and London than it would be, say, in Grey County. And so it's very difficult from a regional perspective when they're looking at funding allocation as to, well, why does it cost X dollars here and it costs X dollars here? And so those are sort of the pieces that we've been working with Ontario Health West to try to help create that base funding. I think it'll come. We've seen it across the province. There's been other other Ontario Health groups that have made funding announcements, and we're hopeful that that'll come in the West region as well. Sorry,
it's okay. No, that's great addition. It strikes me that we may want to put a request into county council and city council to do something supportive and push that up the line to the province about community paramedicine. It also strikes me that building awareness through the type of event that I'm talking about is also a good step, because if we can get all of our Southwestern Ontario partners to say, hey, the time's come for this to be base funding as opposed to one-time funding, that would be a good technique as well. So there's some things we can push up the line a little bit here that would probably be helpful in trying to turn it into long-term funding. So maybe we'll think about what that letter should look like, Michael, and bring it back to the board as well. Stephen, I think you had something else.
Thank you. I see the chief throwing his hand up there, so perhaps.
I didn't see that. Yeah, go ahead.
He's too
Thank
far
you.
away.
Yeah.
Mr. Chair, just briefly on the Provincial Initiative, I know that the Premier has asked Matt Anderson, the CEO of Ontario Health, to come up with sustainable funding for community paramedicine, and the province is currently evaluating that. I know provincially from the Ontario Association of Paramedic Chiefs, we're being advised that proposal is moving through the various channels for review and decision making. So hopefully we'll hear something on a more sustainable funding model in the near future. Thank you.
And maybe I guess my point would be that what would probably help them in their analysis and speeding things up might be some political pressure, if we could get that from a larger group that understands the benefit in their community. So we should probably take this opportunity to make sure the province doesn't forget that real communities out there believe this is a lasting solution, both urban and rural. So anyways, Stephen, I think that's it for Neil. So go ahead. Oh, you're muted there. Just, there you go. That's okay.
See, I'm usually so good at that.
That's okay. It's
Thank you,
Monday morning.
That's right, and thank you, Chair. Both of those are very helpful and good suggestions. I think that's where I was trying to get towards, is how do we find this as core funding rather than continuing it. As they say, you live by the grant, you die by the grant, and having that precarity constantly hanging over a program that's so essential. And thank you for recognizing its importance. The second and last part was just, well, to that gathering part, I think on the paramedic side of things, those are pretty routine and strongly established, but on the municipal administration and political fronts, to highlight the importance of community paramedicine is a really good idea. The COAST program is one that intrigues me a little bit, and there's a lot of different models of mobile mental health crisis support, and I think everybody's kind of tinkering with some of those models. Like probably the one that I've seen is the most intriguing is one out of Sweden, where it's actually paramedic led, and there's a mental health ambulance, and it looks like the rest of the fleet, and nobody knows it's a mental health ambulance, but there's mental health crisis workers working side by side with paramedics. And instead of a confrontational call, which is often what happens when the police lead the response, it's a de-escalative call where the paramedics are leading it along with mental health. So I'll be intrigued to see what the results are of the pilot, and I hope as the pilot proceeds, some of those alternative models are explored as well, rather than just looking at the singular model that might come up through the pilot project too, just kind of looking a little more laterally through it. But I'll really be looking forward to what the results of the program are, and hearing some updates along the way.
Yeah, that'd be great. I think there's some good stuff too that's been passed around out of the States related to a number of incidents that have happened in the States recently. Grand jury investigations, coroner's reports, a number of things around the importance. I've been trying to capture those as they come in, so if you guys see them as well. But the idea of having a dedicated mental health ambulance is something that is being mentioned in many of these reports. And I find that interesting because I actually had the opportunity to tour, where was I, Neil? In England, Sheffield, Sussex. I got to tour their facility, and they not only had a SWAT team ambulance set up, they also had a designated mental health ambulance. They actually had 3 designated mental health ambulances, which I found really interesting at the time. So certainly that trend is growing, as you point out, Stephen, and we're going to have to keep an eye on both the program that we have and the ones that are out there internationally. Michael, anything else on this?
No, just a comment to Stephen's point. There's a researcher out of the University of Ottawa's public administration program that's following this closely and is doing a lot of published research on that. So we're following that as well. He specifically published already on Hamilton's COAST program and Simcoe's COAST program. So our program is already taking some lessons learned from those other programs already. It's being led by London Police Services, to be honest. We're more of a passenger in this at this time than leader, but yeah. We are, things like not wearing traditional uniforms, the unmarked vehicles, those types of things. So just from a de-escalation perspective, not going into it with a uniformed officer or a uniformed paramedic, we're hoping those will be some advantages. But to your point, we are going to follow closely, and I know that it'll be published through Carleton as well. So we'll follow that as well. Thank you.
When do you think it'll be published, Mike? Like, are we talking like next year or?
Well, it's a 1-year pilot, so I presume that they'll wait till the pilot completes and then the pilot's over, and then they'll do the evaluation process following.
Okay, very good. Anything else on this report? I don't see anybody else with their hand up. Curtis, I don't think has his hand up. So can I get a mover and a seconder for this one? Stephen, and seconded by Brian. Thank you, Brian. All those in favor? Opposed? It's carried. I knew you were in, Curtis. I could just feel it. Don't worry. Okay. I'm moving down to item number 4, which is stations signage. Neil, why don't you walk us through this at your leisure here?
Sure. Thank you, Mr. Chair. So to members of the board, the report that is before you today is just an update on our movement to change signs at the station to reflect our new name, which was approved a couple of years ago. As the board will recall, at that time, we said that we would phase in the changes to the signage. And recently, under the oversight of Deputy Chief Marco and Commander Bennett, the following stations, Horizon, Byron, Hyde Park, Strathroy, and Kamulka, were changed over. And the board will see in the report a couple of the changes that were done. So certainly where possible, if we could just minimize the amount of change and utilize some of the current signage that was there, we did so. And certainly you can see that at the Hyde Park station, where we basically just took out the EMS and put in the crest sign. And I think that's a Kamulka station, where we basically did the sign change. And again, at the Horizon station, we took out the EMS and just put in the crest again to again ensure the branding was achieved in the most cost-effective manner. So this is for information for the board, but I'm happy to take any questions. Thank you.
All right. Questions? Any initial thoughts? Okay. You must have done a great job on that one, Neil. Mover and a seconder for this one. CBJ, seconded by Stephen. All those in favor? That's carried. Okay. I'm moving on to, it says 3 here, Kathy, but I think that's just a typo. Number 5, which is the draft 2021 budget for Middlesex London EMS Authority. Presentation of the draft budget will be made at the meeting. Okay, so Neil, how did you want to proceed on this?
So, Mr. Chair, we have a slide deck that we'd like to take the board through to give an overview of what is being proposed for the budget projections for 21. And we'll take it from there under sort of your chairing the meeting as to the next steps.
Okay, wait a second now. So you want these budget slides up, is what you're saying? That's
Yes.
what you were trying to say there, okay. So just tell me what you see. And do you see it in a size that is okay, or do you want it bigger?
They're up. It's not as a slideshow. It's showing the slides on the left and the main slide on the right.
Okay, is
There
that better or worse? Is that okay though, if it's like that, or?
Yeah, it's fine for me. I don't know the rest of the board.
How's
It
everybody
looks
seeing
all
it?
right. Let's try it. Yeah.
Okay, I can do it maybe more full screen. Let's see how that goes. Better?
That's better.
Yeah, okay. All right, I think you're ready to proceed, Neil?
Sure, and I'm going to probably get some assistance as well from Cindy and at times from Colin as necessary. So we'll walk through this. So for the board itself, areas that they're familiar with that creates budget pressures for Middlesex London Paramedic Service, call volume, our increasing call volume year over year, the ongoing challenges that we have with offload delays. Certainly the provincial funding uncertainty, not knowing year over year what the envelope has been. One of the areas over the last couple of years as well is the presumptive legislation. So PTSD or WSIB, we're a Schedule II employer. And certainly one of the main areas that we continue to be concerned about is the dispatch triage, where first of all, the dispatch is over triaging our calls, and more importantly, the calls that are coming into the system really don't provide the right resource to the right patient at the right time. And that's the dispatch modernization that Middlesex Middlesex County and Middlesex London Paramedic Service and the City of London has engaged in trying to change. So next slide, please, sir.
Okay.
So some of the other budget pressures, obviously in 2020 and going into 21, COVID-19, we obviously are not going to be out of this global pandemic for some period until the vaccines are in place and the majority of the population is vaccinated. In 21, we are going into a new collective bargaining session as our current collective agreement expires December 31st, 2020. And as always, there's always a one-year funding lag for any increases that are presented in the budget. So we've got to wait a year and try to deal within the current year the full impact of the increases. Next, please. So some of the systemic factors, So some of the systemic factors that we talked about, again, the triaging and dispatch calls, offload delays, and again, as we all know, the system does need an overhaul. We're seeing population increases, with whether it be in the county or the city, both are growing. Certainly, we're seeing a shift in demographics with an aging population. We're seeing a demand on, obviously, long-term care placements and ALCs in the hospitals, those areas, as well as Deputy Chief, when he talked about the COAST program and other areas, the increased number of mental health and substance abuse calls as well are impacting our call volume. Next, please.
Neil, I just should mention to the board members, because I got a couple questions here by text. We are going to send this deck out, correct? There's no reason not to, right?
Correct.
Where are you? I don't even see you on the screen. Oh, there you are. I need a smaller screen or a bigger Neil. I'm not sure which I need. But anyways, we'll get this out to you. I guess we can send it out to you now, Kathy, if you're able to, right? Is there any reason not to? Where's Kathy? There she is. Hi, Kathy. So can you try to get that out to everybody now in case they want to follow along? Or
Yes, as soon as I get it, I can send it out.
okay, well, I think we'll work on that while Neil's talking, but okay, Neil, sorry to interrupt you. I just wanted everybody not to be scrambling to make notes because you're going to get this exact thing here shortly.
Yeah. Okay, and the next one here. So this slide here gives the board a bit of a initial 2020 projections. So I'm going to draw you to the very bottom line. Obviously, the approved budget for 2020 was $43,081,555. Our actual expenditures year to date, $35,501,564. Now, at this time, we are projecting a potential expenditure at the end of the year of $44,827,355. So roughly about a $1.8 million more than the approved budget. And these are pressures that we're seeing from COVID. We have made application to the Ontario Ministry of Health. They have two pots of money for 2020, $2 million for the period ending March 31st, 2020, and an additional $75 million for the period from April 1st to December 31st, 2020. We're still awaiting the ministry's determination on the allocation of those. We have made applications, and I know Treasury has been working with the Ministry of Health on this in order to identify our costs, and we've been sending in reports. Part of this as well will have, if I'm correct, included the pandemic pay, which was 100% funded. And we received, I believe, $1.2 million, and we expended, I'm going to look to Colin if he's here, roughly about $860,000 approximately. So we actually will be returning money to the ministry, or they'll be reassigning that potentially as to the COVID costs as well that we're incurring. So just want to flag this. Sorry.
Let's just stop here for a second because there's a couple things I'd make suggestions on for this slide before it goes out too much more into the public. We got to remember that the people that are reading this aren't necessarily listening to this, and this slide will be a popular one. So if you look at this, this looks like everybody's costs are going up because you've used the term budget and you've used projections. So that could be misinterpreted because really the accounting term you're talking about is expenditures. So these are your expenditure projections, not sort of where things are going to be in terms of total costs, right? Is that fair to say?
That is correct. It's not a revised budget. It's
right. So it could, because the actual budget would be different. It'd be much different because you'd have both the revenue side to match against this. So this slide's really just intended to say our costs went up this year, and it really should say initial 2020 expenditure projections and year-end expenditures projection. I can't read that part because oh yeah, there, year-end expenditures, because it even says and revenue related to COVID. So that's all over the map. That chart has to get better, I think.
Now, fair enough, Mr. Chair. And again, I think what we wanted to get across to the board is potentially what we are expending and our not hope, but our expectation is, and working with the treasurer, is that the variance will be funded by the Ontario Ministry of Health.
Yeah, I have no
And
doubt
some-
about it. I have no doubt about that. I'm just saying, if you actually threw this slide in front of me, I'd come to completely different conclusions. And so then the average person's going to come to completely different conclusions. But anyways, we can work on that chart and get it better. Stephen?
Yeah, thank you. I completely agree, Mr. Chair. I think probably the question that I see when I see this is what's the unfunded liability? And,
Right. Yeah.
And right now, when I read this, I see a $1.8 million unfunded liability, but I recognize there are provincial recoveries both from the assessment center work and through the pandemic pay initiative. And I think those are probably what fill that gap, but I think those are important to highlight.
Yeah. Yeah. So we'll have to figure that slide out a little better, I think, Neil, and maybe dig down on it a bit over the course of time.
Absolutely, Mr. Chair.
Okay. If there's nothing else right at the moment, why don't you keep moving forward?
Okay. Cindy, at what point do you want to take over as well?
Sure, I can jump in here.
She looks ready to go.
I'm sure Neil's going to have to jump back in, but this slide just shows the 2020 cost breakdown, and it shows it by percentage. We actually use this chart later on to show the 2021 cost breakdown, and you'll notice that it's very similar in nature. And if you can notice what the biggest, obviously, amount is for, and it's obviously has to do with wages and benefits, which is the yellow piece of the pie. Next slide. So we included the Wsib expenditures in here to show you over a period of time. So from 2016 actual up until the 2021. As part of the budget pressures, we mentioned that the Wsib expenditures are increasing, and it continues to be a pressure for us. Next slide.
Whoops.
And again, we kind of showed it in a pie chart just to give you an idea what is behind the Wsib injuries. So you can see some of our bigger ones are back related. So those would be 27% of the claims. And we also have things that include like eyes, which are 3%, or face. And then we also have some for like your wrist, your hand, and your knee. So it just gives you an idea of what kind of injuries we're seeing in 20.
You know what would be helpful here is if we have it, the same type of chart from 3 years ago. Because I don't
Sure.
think the next chart, like if you had this that said 2016, for example, if we have it, I'm sure we must, that would be quite a different type of chart than this is. And I think that would help the public understand the types of injuries and the impact of the legislation on that. Brian, I had you first. Oh, go ahead, Cindy, go ahead.
No, that's fine through the chair. We definitely can create a chart like that for you and the board.
Yeah, just to see the changes. Maybe a bar chart would be better for that, but we'll see. Okay, Brian, go ahead.
Okay, thank you, Chair. I think that's a great point because we made quite a considerable expenditure on the gurneys and I'm curious of that too with the back, because the point of that was to really help our WSIB. And so that would be a great chart, I think, Bill, if we could get that.
Yeah,
just
that's
to
a great
see how
point.
much the gurneys have helped us.
Yeah, that's a great point. Stephen?
Thank you, Mr. Chair. Thank you, Brian. That's exactly the point I was going to raise, was that I think the anticipation was power stretchers was supposed to decrease injury costs over time, especially on a per medic basis. I would expect that the PTSD proportionality would take up more over time because of the presumptive legislation. But having a sense of those time trends is really important. Seeing the WSIB costs going up is kind of counterintuitive based on the materials and technologies that have been put in place, other than that PTSD legislative change.
Yeah, and I think that's the point. We want everybody to know, actually, let's see. Like, let's get the chart and see. But I mean, was really the goal, was to lower costs in every other area, knowing that the PTSD is going to be a significant factor now that the legislation's in place. Okay. Cindy, carry on. You want to talk about the next slide?
Yep, next slide. So again, we talked a little about this before, but this is a mental stress injury versus a physical injury.
That's a nice one, yeah.
And we have lost time. So you can see that the physical injury, getting stuck in that word, is 45% versus the mental stress is 55%. So it's just kind of showing you what we're seeing in lost time. Next slide. So this is the big slide. It shows the 2021 draft budget projection, but we're actually showing the original budget projection that we actually submitted to the City of London last year. And we're showing you the revised budget projection. And you can see that we were able to reduce the budget for 2021. So
Now
we really went.
this is revenue and expenditures estimates, right? When you use the term budget.
This is our, well, if you look at it through expenditures, yes, total expenditures.
This is total expenditures and it doesn't take into account one-time funding you might get. Is that what you're saying here?
Correct.
Well, then that's a much different slide. So we have to just work on our terminology because it's easy whenever you explain it, but it's hard whenever this gets into the newspaper. That'll be a totally different type of interpretation, I think. It's a good interpretation. It's just that might go down even more once you add the increased revenue that you might get, the supportive revenue, right?
This is the 2021 budget. So
yes.
If we get additional revenue for COVID going into 2021, we would see additional expenditures and we'd have that offset by additional revenue.
Yeah. Yeah, so there's a lot of my point is, I guess there's a lot of caveats here. So provincial funding staying the same, you probably think of all the assumptions you made that aren't listed here, right? Provincial funding staying the same was one of them, I assume?
Absolutely. The same methodology we've used in previous years.
Exactly. So we should somehow have like an asterisk with ching, 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 ching. Maybe there's only one asterisk, but it's a pretty big one because we don't really know what that's going to look like. But this is a good slide and it's a good news slide. Basically what you're trying to say with this slide, if I understand it correctly, is your costs are going down compared to what your original estimate was. And that's what you're trying to emphasize here, right?
Correct. Obviously, when we had to put together a 4-year budget, we had to make a lot of estimates at the time. And after we're able to go back and we know a little bit more, we're able to revise that budget based on more of our actual expenditures that we had seen in 2019 and 2020.
Yeah, because that's a pretty significant number. So we want to get this slide right because this one will be out and about in the public soon. Okay, I'm going to let Cindy keep going unless anybody else has questions about this slide.
Okay, next slide.
Yep.
And this is just that pie chart again. We're just kind of showing you the percentages increase. Like I said, if you were actually compare the 2020 to the 2021, you're going to see for the most part, the percentages really stayed the same. And again, obviously the biggest piece of that pie is our wages and our benefits.
So the pie got smaller, but the percentages of the pie were basically the same.
Well, the pie for 2021 is larger than it is for 2020. The previous slide I showed you before
smaller than the estimate. Yeah.
Yes, smaller than the estimate. Yes, I didn't provide you that pie chart.
Yeah.
In 2021, our draft budget estimate highlights. I want to point out the word that this is just a draft budget estimate, because the procedure after this is we have to go to county council and we have to get the budget approved in March. So first it goes through the budget committee and then it goes through county council to be approved. So this is stage 1 of the budget process. So here's some highlights.
Right, but can we just highlight just for everyone that from a process point of view, that sounds like that's a long process. So let's just make sure that you talk about the interim steps. And the interim steps as well, we'll make the city treasurer aware of the draft budget estimates so that there can be some pre-planning on their part. We can't tell them cost allocation, but we can tell them how the budget is changing and let them make the decisions that they need to make from there about their budget. Right, Cindy?
Correct. And I've actually talked to the City of London Finance Department in the last month and told them that we'd be having this meeting. And after we had this meeting and we had the draft budget estimate, I would report back to them.
Right, that's just important, like sub points to make sure we don't skip over. Okay, carry on.
Okay, so the first one is the addition of 3 new 12-hour ambulances that we're going to add in 2021. The proposed enhancement will add 12 full-time paramedic positions. The next big one is the paramedic salary and collective agreement placeholders. So you already heard Neil mention before that the collective agreement expires on December 31st, 2020. So in this budget, we have included an amount that we believe will be able to address our costs. The proposed budget estimate includes additional funds dedicated to paramedic training. So we know that there's ongoing paramedic training is required in order to meet expanding paramedic scopes of practice and health and safety requirements, including COVID training for paramedics. We also have some additional funds been allocated for WSIB claims. So we've talked about that before. We showed the slide where we're seeing those increase in the WSIB. Middlesex London Paramedic Service has experienced a rise in the WSIB claims over the past several years. Again, we showed that in the previous slide. And our loss of earnings have risen significantly as a result of the mental stress and post-traumatic stress disorder, PTSD claims. And the last one on here is we've included in the estimate proactive investments in employee mental health for employees. This includes EFAP services, a consulting psychologist, and a dedicated peer support team. And I think that goes back to some of the questions that we were asked earlier. How are we addressing our WSIB claims? What are we doing to be more proactive? And these are the kind of things that we're looking at continuing to do.
Okay, so we'll get into these in more detail, each of these things as we go through, right, Cindy?
Well, I'm going to suggest if you want to ask some more details of these, you should we could do that now, and
Okay.
either Neil or Colin can jump in.
Yeah, okay. So, because you have more highlights on this next slide.
Yep.
Okay, so you want to ask about these now. Okay, that's good.
Sure.
Let's do that then. First off, who has questions about this? Stephen, go ahead.
Thank you, Mr. Chairman. Thank you, Cindy. So these will be helpful. It's good to have a sense of what the cost drivers are, and this lays that out. I don't have a chance to see ahead in the slide deck, but as these are kind of the primary drivers, it would be really helpful to have a sense of how these drive, like in a dollar figure or percentage, both dollar and percentage, the budget change from 2020 to 2021. So for example, 3 new 12-hour ambulances is probably about $1.5 million increase in annual costs. The collective agreement, there's going to be a certain percentage over the current amount on that 73% of wages that take up the entire budget. Also, in terms of training, adding additional training time is usually quantified in the amount of days of training per paramedic. In this case, I'd imagine it's probably 1, but I'm not sure if it's 2. It's hard to jam training days in for the entire staff. So, and that usually has a dollar figure with it, the WSIB. So those kind of that, and from the previous slide, we saw the reduction of what the forecast 2021 budget was versus where the new amended forecast was. What's the difference in the change from 2020 to 2021, rather than from the 2021 to the revised 2021? I think those will be the helpful things in helping to set and monitor the budget as we go forward.
So Cindy, do you have a slide about that now, or should that be something you bring back to our meeting on Wednesday?
I think we should bring that back to our meeting on Wednesday.
Okay.
My understanding was today was to kind of give a high level.
Yeah, that's fine. That's exactly right. We wanted to see where you needed to dig deeper, and we're giving you some suggestions on that. So I think what really we're talking about is the delta between, for these items, the delta between 20 and 21, both proposed and budgeted, or actual, I guess is what I meant to say. So that's what we're looking for. So we can work on that between now and Wednesday. Does that sound about right?
Correct. Yep.
Okay, anybody else on this slide? Like, for example, in this 3 new 12-hour ambulances, maybe that was 6 were proposed for 2021 in the original estimates, right? So we'll show the actual dollar difference and then a bullet on that. So that'll be great.
Through the chair, correct. We can do that for you.
Yeah, thank you. CBJ? Oh, you can't unmute. There you go.
Yeah, no, there we go. Just on that, the 12-hour ambulances, and I don't know, just like Stephen said, like I don't know what the slides are ahead, but just in the terms of call volume, if we could have also kind of an update on how that relates to our call volume, because I know throughout the year the call volume has been up and down, a lot of it related to COVID, but I'd appreciate that kind of tie-in as well, please.
Through the chair, we can add that as well. And I guess maybe I should have started, or Neil can, as a conversation around COVID, because in 2020, our budget has been clearly impacted by COVID and the impacts of that, and how we budget for 2021. So it's difficult, as you can well imagine, because we're not sure how long we're going to see the impacts of COVID and what they're going to look like. And then when we get later in the year, are we going to see that huge increase happen again to our budget because everybody is back to going back to the hospital, using the ambulances like they did in the past. So we expect that the call volume will go back to what we were seeing in 2019 and those increases continuing. Neil, did you want to add anything to that kind of a comment, just that overall nature of the impact of COVID-19 and how we're budgeted?
Mr. Chair, can you hear me?
We can. I like that you're getting your exercise today. I was thinking about getting an elliptical chair, but you've got a new system for this.
Yeah, so a couple things to Stephen's comment about the percentage increase 2020 over 21. There is a slide coming on that's in this deck, so we'll be able to provide that. But further information on the dollars, we'll make sure that's available for Wednesday. But just to really recap, the 2020 budget versus actual expenditure during a global pandemic, I think we all will realize that this is not business as normal, and that a lot of assumptions we made are to a degree totally changed. But certainly we'll provide for Wednesday an update on call volume year to date and our projections going forward as well to see where we are. But the reality is we're in stage 2 now, and we are seeing hospitals back at 100% capacity, and we're not even surging in, say, the Middlesex London Health area at this time. So we do expect, and that's been a concern raised provincially as systems surge, that the impacts on emerge departments and emergency services such as paramedics will also be strained as well. But we're working to address that.
What's your definition of surge?
Surge is obviously the second phase, and certainly seeing a dramatic increase in the number of positive cases and the increase. Sorry.
So you're not talking about call volume there surging. You're talking about case counts surging when you say.
I'm talking about COVID cases that we're dealing with, not only through paramedic calls, but also the emerge department and how it's impacting hospital resources.
Okay, great. I just wanted to make sure I understood your definition. Good, perfect. Okay, any other questions about this slide? Brian, Curtis, I guess we're good for that one. Okay, let's move on to some more highlights. Go ahead, Cindy.
Okay, thanks, through the chair. The next slide just talks about us needing to add some additional funds dedicated to auditing, quality assurance, and risk management initiatives. The next one talks about, and we will come back again if you want some additional information in regards to the dedicated auditing, quality assurance, and risk management. There is an FTE involved in that one. The next slide talks about allocated additional funds for consumable supplies, medical equipment. This is due to the projected call demand. So again, that kind of ties back to the questions that you were asking us about call demand, the Ministry of Health requirements, and of course, the COVID-related materials and supplies. As we know, we expect to be needing additional material and supplies going into 2021. And also the inflationary considerations and special operations equipment. I also want to point out also the ability to get this equipment is increased the cost that we've seen compared to previous years to this year. We've seen the costs increase. The next slide talks about the capital costs for the purchase of 9 new ambulance vehicles in 2021 to keep up with fleet department cycle. And I believe, and Neil, if you want to jump in on that, we had this over a period of years. So if you look at the 4-year budget that we submitted, we had the purchase of 9 new ambulance over a period of time.
That's correct. So just for the board, again, this is not only the additional units that we require for the additional staffing enhancements, but also the replacement that's required for our system as well. So at times we projected that we may be slightly falling behind, and that's why you're seeing the vehicles as they are.
And the next point talks about the additional funds for the liability and fleet insurance premiums. So we've been noticing at the county as well that our insurance premiums are going up, and we expect that to continue. We've heard from our provider that that will be happening. It also goes hand in hand with the expanding fleet size and the general rise in fleet and liability premiums. And the last one that we have on here is our rent and station maintenance expenditures. And we have our station lease obligations and planned station replacements. Neil, did you want to jump in and mention anything about the station replacements?
Just a couple. We've got several stations. One is the Triage station, which we are on a year-to-year rent, and the board may recall that's an old Max Milk store that should have been long retired. It really is, again, we're limping along year over year on that one. So that's a priority. And we actually have, I believe, a presentation coming up maybe on Wednesday, giving the board a quick overview of all the stations that we're looking at. So some of them are reflected in 21, some are reflected in 22, and so on and so forth. But we do have some leases coming up, and these have been prioritized for the board's consideration.
And for the first time, we have some good prospects for replacing some of these stations. They're, as I think most people know, they're very hard to put in place from a planning perspective. Okay, so let's deal with this slide, and because I think Cindy said it correctly, we want to dig down deeper on these various items and get more information for Wednesday if there's things of particular interest here. Neil mentioned we are going to hear more about station obligations on Wednesday. Anything you can think of? The moment? Of course, we always have time after the meeting if you want to send me notes saying, hey, it would be great if we had this, this, and this. It doesn't have to be right this second. Please feel free to text me after the meeting with other options after you've had a chance to digest this. I know there's a lot to digest in a short period of time. Okay, let's go on for now.
So
Okay,
this
Cindy?
is kind of a busy slide, but this slide actually shows the 2020 budget, I guess, draft budget estimate, and it's going by percentages. So we've shown the 2020 to the 2021.
Broken down
So-
by each individual area.
Yeah, so
Yeah.
this is how we budget according to these kind of categories, if you want to say that. So you'll see that we have training as one category, we have consumable supplies as a category, vehicle operations, facilities, and as you mentioned, you'll be coming back at the next meeting to talk about what the increase is in for, well, that would be capital, but in our facilities, we have operational and supports, we have insurance, we have our fees and charges, and we have our capital. So it just
Okay.
kind of, and The
So
increases that we have.
this is year over year. Yep.
This is year over year. So when we just went through those highlights, what we believe were big ticket items or the increases that we wanted to share with the board, they should correspond to the increases that you're seeing here in this slide.
Okay, Stephen, go ahead.
Just curious how we treat capital through you, Mr. Chair.
That's a good
Is
question.
it,
Yeah.
dealt with as a debt servicing cost on an operational basis, or is that actually a separate item where we would see that as not necessarily, or do you actually accrue the capital expense in the year of? So if you buy a new station, do you post that in that year, or do you amortize it over 10?
Well, there's our first problem, because you said capital, and then I think we would call those facilities. So that's the language that we need to tighten up. Not you, I just mean, I run into the same problem every year whenever we talk about capital, whenever I change my hats. So I think you're really asking about facility station development when you say that. What they mean here for capital is their operational capital, but maybe you mean all of it.
Yeah, through you, Mr. Chair. I think that the question here is, I mean, what's your annual operation budget impact, where a capital cost, whether that's facilities, vehicles, other capital, might be costs that are amortized over a greater period of time, and you have an annual contribution to offset that. When you see this all in one line, it makes it seem like it's all accrued in a single year.
Right. Okay. So do you want to come back with that, Cindy, or do you want to?
Sure, I can come back with that, because we do look at capital a little bit differently than the City of London does. So we'll come back and have a conversation about that one.
Okay, and then also we'll try to address we will address the amortization question, and so that we detail it instead of just giving a sort of an overall statement about it.
Through the chair, yes, we can do that as well.
Yeah. Okay, so we'll do that on Wednesday too. Anything else, Stephen, on this one, or anybody else?
It's the big one that jumped out for me, but
Yeah.
I think having a sense, Mr. Chair, of I mean, we see a percent increase. I think the dollar increase, so that we have a sense of how that contributes into the overall dollar increase on it. Like if the dollar increase is a $4 million increase, then training accounts for $1 million of it, and new staffing accounts for $3 million of it, so on and so forth, right? So
yeah, agreed. Okay, we'll try to get that for at least one of the days this week. I'm going to move on then, if no one has other questions. Oh, wait a second, it's a big question mark. So that's just broad general questions. I've been able to get, Stephen, I don't have your text message thing, but I've been able to get out the PowerPoint to a few of you already. But Kathy's going to email it out to everybody else so that you have it. And like I said, if you do have additional questions, just text Cindy or I, and we'll try to get it organized for Wednesday. Anything generally pop out? Stephen, go ahead.
Yeah, just a question. Thank you, Mr. Chair. As for you, what form we would see the budget coming to us on Wednesday, and would it be like a budget document, or are we going to see kind of the high strokes?
Cindy, please.
I guess I look to the committee to kind of respond on what they would like to see. If you'd like to see a more detailed budget, if you can go back to the previous slide there, Chair.
Yep.
So we definitely can come back and we can show you at a high level, we can show you what the individual amounts are for per category, and show you that year over year, so you can see that increase. That's easy to do, that chart. And then do you want more of a breakdown, or are you happy just
why don't you do it the way you have traditionally done it, and then if we need to dig down deeper, then we can. That would at least get us started, and then we can always take another crack at it if we need to dig deeper.
Okay, so that's what we will come back with on Wednesday, kind of how we would be presenting to the County of Middlesex. So the budget we do for.
Yeah, and I guess my thought was that's why we have Monday, Wednesday, and Friday. Today's big picture. Wednesday's deeper on the questions that we ask, and then if we need Friday, it would be digging deeper into an individual area that we have questions if need be. That's the way I sort of pictured it in my brain, but we'll see how it works out. Any other questions? Kathy, did you have one? Oh, Brian, sorry, I saw a hand somewhere.
Yeah,
All the way from
thanks,
Elsa
Bill.
Craig, Ontario, I saw it.
Downtown Elsa Craig, Ontario.
Oh, I apologize. Yeah.
Okay, I think you're right that we stay at a higher level, but it would be nice to have that information ready that we can dig down into how those dollars are spent and the breakdown, especially like I look at the training going up 24%. And, you know, that raises some questions to me. Did we get behind a little on training because of COVID? Or, you know, that you're able to break down into those a lot better.
So you can see the dollar amounts, as Stephen
Yeah.
mentioned, and
Yeah.
or are we being proactive, or you know, those types of things. Yeah. Okay.
Yeah.
Well, we will dig towards that for
Okay.
sure. Yeah. And I think we meet in the afternoon on Wednesday, if memory serves. So we'll try to get this out as soon as possible so that you have a chance to dig a little deeper on some of this stuff. Anything else on this? I assume Curtis is happy because I haven't seen him pop up and wave the Elgin flag. Okay, so I think we've got some good direction for you, Cindy and Neil, for Wednesday. Do you have any other questions or anything else you want to say before I take this off the screen? Nope, Neil's
To the
good.
chair, I don't have it.
Okay, great. So here we are, all back again. And I've lost my agenda, Kathy, but I'm getting it back. So it's just going to be received for information, right? This right now? Is that what you had in mind, Kathy? So do we actually need a mover and seconder? This is just here for information, right? Yeah, okay, thank you. I appreciate that. So we'll have more detail on Wednesday, and we'll move on to the correspondence and information items, which there are none, as I understand it. Neil, I'm just going to mute you because I'm getting a bit of feedback. There we go. Thanks, Cindy. And inquiries, are there any inquiries that anybody can think of? Nope. So Kathy, you're gonna have to walk me through what you had in mind here for the authorization bylaw, etc. We do have next business meeting scheduled for 1 o'clock on Wednesday, and then tentatively for Friday at 9. What did you have in mind for this authorization bylaw, Kathy? Oh, there you go.
Legal would like us to start doing an authorization bylaw, but it's not ready yet. So we can just skip that for today and maybe it'll be ready for Wednesday.
And then maybe you can explain to me what you're trying to accomplish before that happens too.
It's like a confirming bylaw, but
yeah, I figured that's what you're trying to achieve. Okay, I haven't seen it, so I guess that explains why I haven't seen it.
I
haven't seen it yet.
So
well, that makes it easy.
Ignore that for today.
Okay, so is there anything else that we need to talk about today? I know we have a pretty full agenda for Wednesday, because Neil, do you just want to run through some of the, like, obviously we want to dig deeper in some of this budget stuff, but do you have a sense of other things that we'll be seeing on Wednesday? Here he goes. There he is.
Mr. Chair, I believe we're going to provide an overview of the stations and the plans to move forward. We'll also provide a quick update on the operational review that's being proposed to take place in 2021. There may be a couple of other items, but those are the two that come to mind at this time. I'll look to my team if I've missed something significant.
Well, it'd be helpful if we could get that agenda, now that we've been through this meeting, up as fast as we can, Kathy. And then
Mr. Chair,
go ahead.
I also remembered as well, I've asked Commander Bennett to provide an update on COVID statistics that the board might find useful as well, utilizing the data analytic technology that we have with First Watch.
Okay, I just got to get this up today, so for Wednesday afternoon. So that can be up there, and we'll get as much information out as we can, right? Neil?
Yes, sir.
Yeah, okay. So I think that's it for today. Like I said, if there's other things you think of, please don't hesitate to text or email me, and we'll get it in line for you on Wednesday. Anything else before we adjourn? Thanks, everybody. Moved by Brian, seconded by Curtis. Oh, he wanted to get his name in the minutes to get a per diem. There it is. Good for you. We're all in favor of adjourning, and it's 10:34. All right, we'll see you Wednesday afternoon, if not before. Thanks, everybody. Have a great day. Happy Monday.